Hi, welcome to my channel, all about nurse. Today we're going to talk about medication administration. This is so important because we give patients medication nearly all day long. From 7 a.m. when we start our shift to 7 p.m. when we're giving report. We give medications like 5 times, scheduled. Then we have PRN in the midst. So we need to know how to give medication. Medication administration. What and how do we administer medication? What are the steps we have to go through? First, to begin, you have to have an order. So you get the order from your doctor. You might be working in a place that they write orders, or you might be working in a place where they have Epic or Cerna. So the medication comes up on the EMR, the electronic medical record, in front of you on your computer, so you can read the order. So you read your order, you get up and you go to the medication or your Pyxis to get your medication out for your patient. After you take the medication out for the patient, what do you think should be your next step? So your next step should be the first right. You should have the right patient. When you go to your patient's bedside or into your patient's room, you ask the patient, "Sir, what is your full name and date of birth?" Why would I ask that? You say to yourself. The reason you ask this question is because people sometimes have the same name and it sounds familiar. So you make sure and get those 2 full identifiers and you check the patient information on your documentation, be it electronic or paper. Then you check right medication. So the doctor ordered for the patient to get Keflex, which is an antibiotic, but you thought you saw Celebrex, which is an NSAID, and you took out Celebrex instead of Keflex. Now this right will make you see and check based on your order. So alright, we have the right patient. Now we realize we don't have the right medication. We have Celebrex instead of Keflex. So this right saved you from giving a patient the wrong medication. Always check your right medication. Next right, we have to make sure it's the right dose. So the doctor ordered Keflex 250 milligrams, but you have 500 milligrams in your hand. What are you supposed to do? You check your dosage on your order. The order is 250 milligrams. That is when you proceed to see if your medication is a scored tablet that you can cut in half. If it is not, you have to contact your pharmacy. How can I get this to be a 250 milligram out of a 500 milligram tablet? Not all tablets are to be cut or crushed. Make sure and read your instructions carefully. Right patient, right medication, right dosage. Now we have the right time. Don't give the patient the medication when it was due at 8 o'clock, at 12 o'clock. If the doctor wrote the patient medication to be done at 8 a.m., please administer your patient medication on time. You normally have 1 hour ahead and the hour of to give the medication. So you basically have a 2-hour span. So if this medication is due at 8 a.m., it means you can give it from 7 a.m. to 8:59, not 9, 8:59. You have that time frame to give that patient its medication. So we have the right patient, right medication, right dose, right time. What's next? Like, oh my God, all these rights? Yeah, right route. Of course, right route. Oh my God. Can you imagine giving this patient the medication that was oral via the parectal? Oh my God, that nurse will be in so much trouble. So there are different routes we give medication. We give medication orally, sublingually, we give medication via subcutaneous, we give IM injections, intravenous, we give per rectum. So do not take it for granted that you take out a tablet and it means it's automatically going in the patient's mouth. And we even give Everescence, which is we put it in the water and it melts. So read the instruction. Right route. Okay? So we have right patient, right medication, right dose, right time, and right route. Then we have right reason. What does that mean? Right reason. So it means that I am giving a patient medication that is coinciding with whatever their complaints are. So I cannot come and give a patient lisinopril or metoprolol, someone who has no past medical history of any cardiac problems or hypertension. If I see my doctor orders lisinopril for a patient that has no history of hypertension, it is my duty as the nurse, the registered nurse, to pick up the phone and contact the doctor. Doctor, this patient is not a known hypertensive, but I saw you put an order for lisinopril. Why are we giving this medication? What is the reason? Make sure to give the patient medication that has the right reason. Do not just give a medication because you see an order. We went to school, we passed an exam, and we have a nursing license. You have to protect that license. We are all human. People make errors. I have had experiences where doctors write orders for patients by mistake. Again, because sometimes patients have the same name. So when he was putting in the order, he put in an order for a patient who did not have high blood pressure, which she was thinking of the other patient, which was the same first name but a different surname, and ended up putting in the wrong patient order. And because I was paying attention, I was able to pick up this patient is not hypertensive. Why do I have an order for lisinopril? So you could get through all these rights: right patient, right medication, right dose, right time, right route, and the reason is wrong. So right reason, remember, that is why we were taught pharmacology. Right reason, girls, remember, girls and boys, right reason. Okay, from right reason, right documentation. So it means you have to make sure you enter the patient's information accurately, the time you gave the medication, the route you gave the medication. So if I'm giving lisinopril to a patient, what am I supposed to do before I do that? I'm supposed to check their blood pressure. I'm supposed to have documentation of a blood pressure being done. So I can't give a patient lisinopril for a blood pressure that was done last night. So right documentation, no shortcuts, no shortcut, right documentation. Make sure the patient information is clear. Make sure that you document the route you gave it in and the time that you gave the medication. And then last but not least, don't forget the patient's right to refuse. Patients have right to refuse. If you go to a patient and you go through all your right patient, right medication, right dose, right time, right route, right reason, and you're going to document and the patient tells you, nurse, I do not want that medication, you are not to force the patient to take the medication. What we are supposed to do is supposed to educate the patient. Sir, the lisinopril is for your blood pressure. Right now, your blood pressure is 175/85. Doctor would like to give you the lisinopril to bring that down within the normal parameters, because it means you're going to be at risk to getting a stroke, and we do not want that, sir, or a hypertensive crisis. If the patient still goes on and says to you, nurse, I do not want this medication, you contact the doctor and document the patient refused this medication. Patient was educated about the reason for the medication and doctor advised or licensed provider advised. Please, nurses, remember the patient has a right to refuse. So again, our 8th right for safe, accurate medication administration is right patient, right medication, right dose, right time, right route, right reason, right documentation, and our right to refuse. So medication administration is something that you have to make sure and be very, very particular with. You have to be serious about what you're doing. You have to be concise in what you are doing, because medications can harm our patients. So that is why there are rules that are in place to make sure that we do safe practice as nurses. That is why we had to study pharmacology, learn all of this pharmacology, mathematics for drugs, all these different things that we learned in our nursing school on programs that we've been through, and we have a nursing license to protect. Remember, nurses, our patient needs to have a safe practicing nurse. So practice our 8th right to make sure our patients are safe and they are taken care of with care and compassion. So medication administration, let's get to it. If we weren't practicing, let's start practicing now. 8th right, get it done. Let's do this. And remember, nurses, we are the best. We do it better. I don't care what nobody said. We do it better. Look out for more videos. Keep it up. Have a good one. Bye.